Now that a House committee is close to finishing work on a health care overhaul bill, its chairman is warning members not to tender any amendments that would make it more expensive. Money's a big issue. Henry Waxman also wants to limit the time allowed for debate. But despite all this, a lot of analysts say there is no way this is going to pass before Congress takes its August break. So will the reemergence of the Blue Dogs and other developments in the House and Senate? Some are looking at the end of 2009 as a more likely timeline. Is it? Well, Joe Krier, president of Krier Wealth Management, back here on the morning show. Let's talk about the move of the Blue Dog Democrats, basically the conservative faction. This debate that's happening inside the party is really healthy when you talk about the future of health care.
Yeah, I think it is. And anytime one party gets too much control, then bad things can happen. And even the investment markets are sort of celebrating the reemergence of the Blue Dogs, because what they do is create that debate that you mentioned. They make the government stand back and kind of reanalyze things rather than pushing it through and trying to fix it later. Let's try to make it as usable as possible right up front.
I remember in 1992 when Hillary Clinton came out with her plan. You could go to the federal bookstore and you could buy, it was a 2.5 volume set, and you could learn about it. The American public doesn't have access to all the information. And there's a lot of confusion, there's a lot of conflict about the whole public option.
Yeah, and people don't even understand their existing health plans, much less another 1,000 pages of bureaucracy piled on top of it. But, you know, in the end, the public option, it's sort of being misrepresented a little bit on both sides. You know, those that want to get rid of it say it's a government takeover. But in the end, what it is a public alternative to private insurance. So all they want to do is create a plan that can compete against private insurers. The Republicans say there's no way it can compete fairly because it'll be heavily subsidized and ultimately will just take over the whole system. Then we'll no longer have private insurers. And of course the Democrats say, hey, that's a healthy and competitive alternative for consumers.
You know, I think you and I both agree there is no way in Hades they're going to reach that deadline before the August recess. And some people sit back and say, okay, if we make this happen by the end of the year, we're in good shape. Is that a realistic timeline as well?
I think it is, you know, and I think there's going to be an admission by the Obama administration that, hey, we're just not going to get this done the way that we proposed initially. If there's a few things that come out of this, let's say the whole thing is reduced to 200 pages and 5 or 6 good ideas, then it's still a step in the right direction. I think a sweeping overhaul that goes in the direction of the government running the entire healthcare system scares too many people, even the staunchest liberals out there.
Do you think that they'll address 2 other real issues that need some attention, insurance and tort reform?
I really do. And in fact, I was kind of a couple weeks ago when we talked about this, I was a little disturbed that I hadn't even heard the word malpractice in this. Well, it's starting to come up now. And in fact, some of the ideas that are emerging are to have a separate healthcare court system and, you know, limits on pain and suffering awards. And if you look at this, when every dollar you pay to your insurance, 30 cents goes to the bureaucracy that's already in the insurance companies. Another 20 cents goes to the tort coverage, malpractice insurance and things. So only 50 cents of your insurance dollars are actually going to the doctors. That's got to clean up. And if they really want this plan to go through, they've got to show that they can do it without incurring more administrative costs.
Are you optimistic with another 5 months of debate we can come up with a healthy plan for a healthy American public?
I think so, because, you know, remember, every month that we go forward, we're getting closer to another round of elections, and people have to start thinking that way. And also, Obama's been very good at figuring out ways to explain things to try to get people to understand it. If they really want to get this going, they need to put out there the list of people that would run it. You know, right now it's a black hole. People say, well, if we vote, then what happens? And they don't know what the end result is, and the law of unintended consequences. There's just a whole lot of questions out there. They need to start filling in those blanks, and then they can get this thing through.
All right, assuming they fill in the blanks, assuming we have something on the table that's workable by 2009, what's the timeline for impact on us?
Good question. It goes out a little ways here, you know, and actually the tax increases or the surcharges that would pay for it don't even start till 2011. Then 2013 are when some of the mandates come in that kind of force people to have coverage. They want everyone covered by 2013. They want to force small employers to offer a plan. And then 2014, they expand it just a little bit further. So you're still talking 4 to 5 years out before the whole plan would be in place.
All right, Joe Krier with Krier Wealth Management. Always a pleasure to have you here. Appreciate your insights.
Thanks, Bruce.